Well, I opened the clinic in June 1 of 1985. As far as I know, I was the first veterinary clinic that limited to vaccinations 40 years ago. I don't know of anybody else who was doing that. So my intention was only to do vaccinations. But as time went on, people would come in and their dog had a problem. They said, well, I can't afford to spend hundreds and hundreds of dollars over at X number hospital. Can you help me out? And so I began treating patients on an outpatient basis. That expanded so that I said, okay, fine. So now we do vaccinations and minor treatments. We do have the capabilities for lab work, but if an animal requires more than what we can do, we'll refer to a hospital in the area. But most of what people come in for, we can take care of and provide them with an option between spending money they don't have and doing nothing for their dog. Looking back 40 years ago when I started, there are just phenomenal medications that have come out and procedures that have come out that were just unheard of. And then the medicines that we've had for allergy and controlling that. I mean, probably the majority of what we do here is dermatology with animals that are allergic to something or they've got a bad flea problem. And the dog's staying up at night, the owner's staying up at night, the dog's miserable. And there's just so many things now that we can do to make them comfortable that's just amazing. Convenient, compassionate care was basically a summary that I want people to be able to come in, be seen, and leave, not have to spend half their day. And then the compassionate care, my habit for 40 years has been when I walk into the room, the first time I meet a client, I introduce myself, I say their name and chat about their animal and chat about how long they've had their dog or their cat, and then get into the medicine of that. So it was a good friend of mine. He said, that's what you need is ambiente. You need to establish the atmosphere and the ambiance and then get into the medicine. And so that is the compassionate care to the point where it matters to me whether what we do is helping the pet or solving the problem or getting it taken care of. And if I can't do that, then I will direct wherever I can to see that the problem can be solved. That's the kind of care that I want to provide. I have a small handful of clients who are the third generation clients. I mean, I saw their folks, I saw their grandparents, and it's not uncommon for somebody to come in, it's grown up, and they go, oh, Dr. Leland, I used to come here when I was 6, 7, 8, 9, 10 years old. And I go, oh, wonderful, I feel so much older now. So that has been fun, that we have become a family tradition for a lot of people. One of the things that I absolutely enjoy is when I'm sitting in my office doing whatever administrative stuff that I'm doing, and I hear the staff up front chatting away with a client that comes in, or especially laughing and enjoying the client that comes in. And I think that's music to my ears. When people come in, they feel a sense of they're going to be my advocate. They're not going to be my adversary. One of the things that I really enjoy is seeing the comments that people will give after having had a visit here. We consistently are 5-star. And out of that, probably the majority of that is people go, wow, the staff was so kind and so helpful and so friendly. I really like that. We have been taken good care of by the clients here in the area. They have supported us, they have appreciated us, and I never take that for granted. I love it to be able to do things that make a difference and improve the life of the pet. There's another veterinarian, I didn't coin it, but he said more good years together. And that's what we want to try to do, is make sure that people have more good years together with their dog or their cat.